Hi, my name is Cynthia Posa. I will be talking to you today about effective communication skills. My article that I've chosen to use to support my topic is Manager's Duty to Maintain Good Workplace Communication Skills by Fiona Timmons. First of all, just having an understanding of what communication is about is truly just having a message and trying to get it to another individual or a group. And within that, it's important to know that there are certain ways that can be productive and positive, and then there's also ways that can be counterproductive. Leaders need communication in order to be able to work together with others to accomplish goals and visions. This takes skill because many different situations can occur daily. Examples of leaders in the healthcare industry are nurses, charge nurses, managers. Developing interpersonal skills is very important when it comes to communication. Role models, guiding and encouraging is part of effective communication. Important things to take into consideration with communication skills are self-awareness, conflict management, attitude, voice, tone, body language or body gestures, timing, and location. The first priority for all of us in the healthcare industry should be the safety of patients. And without good communication, there can be many risks that can occur. Team members must speak to one another respectfully with a plan. This alleviates misunderstandings or possible errors that can harm patients. When people do not speak to one another and assume what the plan might occur, it can be very dangerous because minute-to-minute changes can occur. So it is important to communicate this to others that we are working with. How a leader, such as a charge nurse or manager, represents themselves can make a difference on how their entire unit can be, and it also can set the mood or the tone. Being approachable can also be a very important factor. I've worked on units where managers or even nurses were not approachable, and it caused a lot of conflict on the unit because people would not speak up and the problems would escalate. Not only for that reason, for a nurse manager, they're not approachable and their followers, such as the nursing assistants or the nurses, don't speak up. There's good ideas that could be set aside that could actually be productive and helpful on the unit because a nurse manager or any leader cannot think of everything. And great creative minds put together can be a very good thing for any organization to improve upon. Next is the ability to listen. That is a big factor in communicating. Many people think it's just about speaking, but it also is having good listening skills, because when other people know that you're listening, they're willing to speak more of their thoughts and ideas. And in doing so, it's important that you give good eye contact to them, because when you do not, it feels like the other person or group is being ignored, and they may not feel that you're approachable in discussing or worth discussing things with in the future. Another good way to communicate amongst a group, not only one-on-one, of course, can be a good idea, but in a nursing setting, during staff meetings can also be a good place to communicate, because it allows the team members or followers to know that they're important and that what they have to say means something to the leader. So it's important to take that time and allow some input. On the note about listening, giving good feedback as well is important when you choose to be a good listener. So listening to the whole entire conversation is important in order to use relative information based on what the person is speaking to you and giving that feedback properly. However the leader demonstrates themselves on the unit is very important. That's part of the role modeling. If they speak in tones that are very harsh, it sets that for the rest of the team members, or even the mood on the unit. So it's important to give confidence, motivation, to keep a positive morale on the floor. Self-awareness is really important, and by doing so, you can do that by reflecting upon the way that you carry out your role as a leader and communicating with others. And a good way to do that is videotaping yourself or looking in the mirror and doing speeches and just seeing how you carry yourself when you speak to others, which can improve in this skill. Leaders need to have the skill to speak with emotion with each different situation, because there are situations that are happy moments and there's going to be situations that are very difficult situations, especially as a nurse or a nurse manager. There's conflicts you have to deal with, and you need to have the appropriate responses. And when it comes to patients, there's going to be patients that are filled with anxiety, pain, or depression, and we as healthcare providers need to know how to communicate back to these people who are expressing these emotions, and being prepared as well, because sometimes it can be very trying, but it's important on our part to know how to respond in these situations. And we have to be able to listen with empathy and knowing how to respond appropriately, such as with bad medical news or a death in the family for a patient or of a patient. Is important that we are able to be there to listen to family members and patients. Another situation in effective communication can be background differences in education or culture. It's very important to acknowledge in a conversation a little bit about the person before carrying out a full conversation, so that we do not insult by accident their cultural background or use gestures that are inappropriate, and more importantly, not to use language or jargon that the other person does not even understand. If there is difficulty, it's important to clarify that they understand what we're speaking about. And secondly, if there is a language barrier, such as someone speaking Spanish and doesn't understand a word we're saying, to reach out and find ways to translate for them. May it be the two-way service phones that we have in the hospital, or there's translation books or Google that also translate to help someone understand better. But keep in mind, in the medical field, it's important to try to use the phone services because of legal reasons. When we also think about communicating, it's important that it's not just speaking, texting, or emailing. Documenting in the medical industry is really important. It is a form of communicating with other multidisciplinary team members, because today with computer systems, a lot of what we do is looking at other people's notes. So being thorough in how we document is a huge part of communication, so that we can carry out a good plan of care for the patients and make sure that we're not duplicating our work or missing certain tasks that need to be completed to enhance them into their healing. Lastly, the most important thing that we need to keep in mind is that whatever we're trying to say, this is a message, and this message has to be related to the person or organization or group that we're speaking to in a way that they understand. So taking the time to get to know a little bit about the person you're speaking to can make all of the difference. Thank you for listening. Have a great day.